I'm talking today with Debbie Toomey, who is the coordinator of the Tufts Medical Center Injury Prevention Program, and is going to be doing a program for us here at the library, live on Zoom, on YouTube and Facebook. The program is Aging Strong, and it's happening on September 22nd, 29th, October 6th, and October 13th. That's 4 consecutive Tuesday mornings at 10 o'clock. Debbie, thank you so much for joining me out here and talking to me today. I'm really glad that we can do this program together.
Clayton, I'm so happy to be here and to be able to share to the members, the public, about the Aging Strong program that I created for Tufts Medical Center. It's an evidence-informed program, and I'm working on another organization to make it evidence-based. And basically that means, what does that mean? Yeah, what does that mean, evidence-based? That sounds so fancy. It just means that evidence-based means it's research proven. So in creating this program, which is basically, it's a falls prevention program and also a program that motivates the aging population to continue to move, to continue to learn, to be a lifelong learner, and how that can make a big difference in the way we live our life, the way we communicate with others, the way we take care of ourselves. So evidence...
The aging population really does talk about, I think you mean people that are kind of at the advanced stages of aging. Hopefully we're all aging, otherwise what are we doing?
Yeah.
But this does, these sound like tips that would be great for everybody to learn.
Oh, definitely, definitely. I mean, this is great for the caregivers, the people who consider themselves in the sandwich generation, like myself. I'm a nurse, injury prevention coordinator, but also I'm a mom, I'm a wife. I have 3 boys, and also I have parents who are really young at heart and active. So I'm in that sandwich generation, but still can benefit from the information that I will be sharing. So people 50 and up, I would say, would benefit. Okay. Again, just going back to the evidence base, so a lot of the information that I'll be sharing that I created, that I added to the program, are from the research. So that way you know that it's legitimate information.
So you're not just making this stuff up. This is actually based on looking at a lot of different people and what has actually been proven to work. Yes,
yes. A lot of information from the CDC and also the National Council of Aging.
So Debbie, I'm curious, obviously the program is going to focus on what you just said and helping people learn how to age strong. Something that I wouldn't expect that you're going to cover a lot, but maybe really interesting to know is a little bit more about you and how you got to be interested and even how you became a nurse and became the coordinator of injury prevention at Tufts Medical Center. Help us get to know you a little bit. How long have you been a nurse for?
Oh my gosh, I've been a nurse, I'm going on over 30 years now.
Get out.
Yes, I'm out. Yeah, so I graduated, I went to...
when you were like 3, I guess.
Oh gosh. Well, you know what, I was born in the Philippines, but basically grew up in Quincy.
Okay.
I've been here since I was 9 years old and went through the Quincy Public School System. Right. Loved going to the Thomas Crane Public Library and Quincy Square and all that. So, and currently still live in Quincy. So my heart belongs here in Quincy. And I love to be able to share any type of programs that can, it's in alignment with health and wellness. I became a nurse because I didn't know back then when I was little, but one of my core main values is helping people feel better. Mm-hmm. And for me, that translated into being a nurse. And graduated from North Quincy High School, went to UMass Boston for nursing. Right before graduation, I got a job at Tufts Medical Center. So I've been there. I pretty much grew up there at Tufts Medical Center.
Wow, that's quite a story. That's really rich. So you were like frontline working in one of the departments, I assume, for a bit before you became the injury prevention coordinator? Or?
Pretty much. I spent a lot of my careers working in the adult side, medical surgery, and then learned and also took care of and got trained in taking care of cancer patients, orthopedic patients, cardiac patients, and then I transferred to the anesthesia department, and now I'm in the trauma department. So Tufts Medical
Tufts
Center.
is a trauma one center. You see
Yes.
some really serious trauma at Tufts.
Yes, that's right. So it's a level 1 trauma center, and basically just like Boston Medical Center, Brigham Women, Beth Israel, Mass General, we're all the key Boston hospitals are level 1 trauma centers. And then there's level 2, level 3.
Car crashes,
Yeah.
if there's a complicated, any kind of complicated injury,
Yes.
whether it's a fall, whether it's a violent attack, I don't know the majority of the accidents. And
gunshot wounds, fatal car accidents, a lot of the really complex admissions or, accidents that the suburbs, the suburban hospitals are not able to take care of. They transfer them to the bigger hospitals like Tufts Medical Center.
And I'm sure in doing that work, you had to witness situations where people had that significant trauma that could potentially have been prevented if they had taken more attention to how to increase their strength or maintain their strength as they were aging.
Yes.
So I assume that was kind of the bridge from that work and saying, wait, how do we go about not just putting on Band-Aids and very, very complicated Band-Aids to actually preventing the injury in the first place?
Exactly. So it was one of the key takeaways that I learned being a nurse and taking care of hundreds, thousands of patients is how important prevention is. How important it is, just like, starting, the forest fire, Smokey the Bear, it's just so...
Only you, that's right.
That's right, in the hat, right? But prevention is just such an important element, and there's really not too much funding in that, nationwide. So it's so important to really put that in the forefront of your, thinking, how important it is to think about what you're doing and also know the resources that's available, because there's so many free resources, really amazing free resources out there to educate everybody on how to make healthier and safer choices, right?
And that's why I'm really glad that we at the library can help with that. We love providing, everything we do is for free, and our specialty is connecting people to resources. So thank you so much for bringing this, Debbie.
Sure.
Let's talk a little bit about, so there's going to be 4 sessions. They're starting, on the first session is going to be learning about exercises. The second's learning about, I think, skills. Then we're doing communication, and then putting all together in the 4th. My understanding is that, and obviously as I spell it out that way, there's going to be benefit from attending all 4, and so hopefully most people will be able to do that. We will be recording them so that if people miss one, or let's say they're only even watching this video with us right now after the first one has already passed, they can come in and watch the recording. But if people are super busy, do you think they could just drop into the 3rd and say they really wanted to work on their communication skills, but they feel like they're doing a great job with exercising and they're super coordinated, but geez, nobody will ever understands what they have to say, or they're not very good at communicating their needs, or they've just been frustrated. Would you recommend? I mean, not that you'd recommend. We'd recommend that people attend all 4. But is it going to be possible to just drop in and participate as people are able?
Yes. So yes. So the answer is yes, 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 yes.
Awesome.
I do encourage people to participate, in all 4 sessions, because I created it so that each week builds on the other. So like you said, week 1 or session 1 is strong body. So everybody knows that it's important to move, to exercise, right? It's important. So I just kind of break down different types of exercises. We do a warm-up, and also we go over some of the exercises provided by the physical therapy department from Tufts Medical Center.
Maybe you have some tips to keep that from being boring. I find that's an important exercise, but sometimes it's just like, really? Another walk around the block? Oh.
Yeah. And also, I try to make it so, and I'll be honest with you, I go to the Y, I walk, but when I used to think about exercise, there's just like I have an image in mind of what exercise is, or you see the magazines and you see people exercising. But what's really not explained is there's different types of exercises that's important to kind of focus on as we get older. So that way we're balanced in our body, we're more coordinated, and we have more endurance. So that's something I'll cover. And then session 2 is strong brain and strong mind, because as we get older, the brain changes, the mind changes. And so the cool thing is there's exercises for both. And that's actually a popular one because I introduced mindfulness to that. And that's one of my passions is mindfulness. And a lot of the people who I've shared mindfulness exercises with are just, they love it. They love it because when they think of mindfulness, they think of, oh, okay, I gotta go away. I gotta go and I have to meditate and I have to empty my brain. No, that doesn't. It's impossible to empty the brain. So we go
you just
over
need to sit with your brain. That's right.
Sit with your brain and notice what's going on in the brain. That's mindfulness right there. So that's session 2, and then session 3 is helping the person become more of a stronger advocate for themselves when they're in front of the white coats, the white coat syndrome, right?
The
like the doctors, the pharmacists. Sometimes we get, we have things that we want to go over with them, but when we go there, when we finally get there, we get so intimidated sometimes, and all we do is just say, yep. So giving them information, giving people information, basic information that can help them jog their memory when they're there, or just kind of go over some basic questions. So that way the doctor knows that the person who is in front of them has given them as much information as they can. Because you know what? Nurses and doctors, we don't read minds. We don't read minds.
What?
We want to hear from you. We want to know how you're doing. Don't be shy. Please let us know so we can help you best. And then session 4 is a strong plan. So based on what you experienced the last 3 weeks, which ones do you think you might want to start using for the next 30 days maybe, or for the next week? So that way you'll be able to have a stronger idea of what to do after the program. It's not a program that I hope people say, oh, that was nice, and then they forget about it.
Right.
So,
well, that sounds like it's going to be a wonderful experience. I hope lots of folks were able to tune in, and we will be recording them and sharing them in the future, so that people who aren't able to do it live can hopefully benefit as well. So I'm really excited to be doing this together. Thank you so much.
Yeah, I'm very excited too. And the only thing I would ask for people to do is just make sure they have a chair when they're doing the program. So that way, you participate as much as you can, but know your body, have the chair available. So that way, if you want to participate and just, do the movements, sitting down, do that.
So doing this on a phone on a stand-up paddleboard is not recommended.
No, not at all.
Okay.
No, not this time. Find a safe, comfortable place, and just make sure that you listen. And as you explained, it's recorded, so don't feel like you have to take so much notes. Just take in what you can, because how I explain things and what I go over, I can assure you, you already know. You already know. It's just me trying to remind you of certain things.
And if you think you know this can also just kind of help reinforce what you know and make sure that you're, taking the best care you can of yourself.
Yeah.
Great. Debbie, thank you so much. I'm really looking forward to this. And I will be introducing each program just to kick everything off and say hello. So I'm looking forward to seeing folks who come and participate.
Great.
Thank you, Debbie.
Clayton, thank you so much. I'm looking forward to starting. Oh, actually, September 22nd is the first day of fall.
That's right.
It's the perfect day to be starting this program because that's Falls Prevention Awareness Week.
That's right. So we can be aware of fall while preventing falls. That's good. Excellent. So I hope you enjoyed our conversation. That was me talking with nurse Debbie Toomey, the coordinator of the Tufts Medical Center's Injury Prevention Program. We were talking about the Aging Strong program that's going to be happening here at the library via Zoom and on YouTube and Facebook, happening on September 22nd, 29th, October 6th, and October 13th. Those are all 4 Tuesdays right in a row every week from September 22nd to October 13th, and it will be happening at 10 o'clock in the morning. Each program is going to be about 90 minutes long. So make sure when you join us, you get a comfortable chair, and we look forward to seeing you there. Keep being strong and healthy.